Welcome back to Module 2 of the Community Engagement Learning Package, which is on strengthening health systems through community engagement. Module 2 is split into two parts. This is the second part, and this video is on strengthening health systems, primary health care, and the essential public health functions in the context of making progress towards important goals such as universal health coverage and the Sustainable Development Goals. My name is Saqif Mustafa, and I work on health system strengthening and resilience at the WHO headquarters. I have a medical and global health policy background, and I've worked in a range of clinical care, academic, and community settings in both high-income and low-income country contexts. And it's my pleasure to be taking you through this video. In this video, I'll discuss health system strengthening and how it can contribute to key global health goals such as universal health coverage, the Sustainable Development Goals, and health security. I'll then go on to explain the importance of primary health care and the essential public health functions, and how they promote the role of communities and community engagement in building more resilient health systems that are able to progress towards UHC and the SDGs. It's important to first understand what health system strengthening, universal health coverage, and health security are. Health system strengthening is essentially any significant concerted effort to improve the performance of the health system, and is often through improving one or more of the health system building blocks, which we discussed in video 1. Universal health coverage means that all people are able to receive the health services they need of a sufficient quality to be effective and without financial hardship. Beyond the intrinsic objectives of UHC, such as equity in use of health services, quality, financial protection, and the resilience of services, it entails individual health security, the value of protection against risk. Individuals and communities are better off knowing that if something happens that can affect their health and well-being, whether that's a heart attack, a mental health issue, infectious disease outbreaks, or natural disasters, they will be able to obtain the necessary health services. As Joe Cutson and Susan Sparks elegantly put, health system strengthening is what we do, universal health coverage, health security, and resilience are what we want. A last point to make on this slide is that health system strengthening is absolutely fundamental to making progress towards UHC, health security, and resilience. And these are important goals to strive towards for the health and well-being of communities. In this slide, the importance of health system strengthening in relation to achieving the Sustainable Development Goals is highlighted. Health system strengthening is an enabler for high-quality services accessible to and utilized by those who need them. This supports universal health coverage and the achievement of SDG 3. Strengthening health systems also yields benefits beyond universal health coverage, the health sector, and SDG 3. This is by improving the health and well-being of communities. What this can do is it can enable people to climb out of poverty and reduce malnutrition. It can strengthen health systems and improve the health of populations, enabling people to work towards education and employment. Strengthening health systems can promote gender equality, and certainly good health and well-being of communities can spur local and national economic growth. Primary health care contributes to building the resilience of health systems and communities in a number of ways. Primary health care is often the first point of contact between communities and the health system, and this can ensure the responsiveness of health systems to the voices of people and communities. Primary healthcare services can often cover the majority of a person's or community's health needs throughout the life course, including prevention, treatment, rehabilitation, and palliative care. It's a whole-of-society approach to health, and this is critical for effective public health emergency management and tackling other health threats that require multi-sectoral action. This approach enables active participation and engagement with local government, civil society, and volunteer organizations, as well as individuals and communities. Primary health care includes a number of key elements needed to prevent health threats and ensure health security and resilience to, for example, epidemics. This can be through effective risk communication and health education, and more broadly by ensuring linkages to essential public health functions such as surveillance. Strengthening systems at the community and peripheral health facility level is also a critical part of building resilience. WHO's operational framework for primary healthcare, building on the Astana Declaration, defines the modern concept of PHC and describes the components of a comprehensive primary healthcare approach. First, integrated health services with an emphasis on primary care and public health functions. Meeting people's health needs through comprehensive promotive, protective, preventive, curative, rehabilitative, and palliative care throughout the life course, strategically prioritizing key healthcare services aimed at individuals and families through primary care, and the population with essential public health functions as the central element of integrated health services. Second, multi-sectoral policy and action. Systematically addressing the broader determinants of health, including social, economic, and environmental factors, as well as individual characteristics and behavior, through evidence-informed policies and actions across all health sectors. Third, and incredibly important and of particular relevance in the context of this learning package, empowered people and communities. Empowering individuals, families, and communities to optimize their health as advocates of policies that promote and protect health and well-being, as co-developers of health and social services, and as self-carers and caregivers themselves. Primary care and public health workers are likely to be the first point of contact for those seeking care for injuries, infectious diseases, and other emergency-related illnesses. Primary care workers are often responsible for dealing with health emergency case management. This may involve disease-specific case identification, treatment with appropriate infection prevention and control procedures, and safe onward referral if needed. The primary care response to specific health emergencies such as cholera, influenza, Zika, or COVID-19 may include both case management at the primary care level and other public health activities such as notification, disease surveillance, and preventative interventions such as vaccination. Well-trained and equipped healthcare workers can therefore act as sentinels in the surveillance of disease outbreaks and play a major role in the detection and early warning. Primary care has an important role to play in proactive engagement and appropriate communication with communities, which not only supports an effective emergency response, but also empowers communities to prevent avoidable emergencies. Effective engagement also improves the ability to anticipate and identify events and reduces the impact of inevitable events when they occur through co-developing appropriate and trusted systems before, during, and after an emergency. As primary care has pre-existing links with communities and has the capacities and networks to understand the environmental, social, and cultural elements that affect health, it can deliver context-appropriate care as well as effective risk communication and continuing work with the communities throughout the emergency into health systems recovery from the disruptive event. Depending on the health system, primary healthcare and public health functions that are preventative and community-focused can be provided across the different levels of the health system. For example, when a patient is in a secondary or tertiary level facility receiving specialized care, it is still important for healthcare providers to understand the local and community context, socioeconomic and cultural setting and ideas, the ideas, concerns, and expectations of the individuals and their families. Healthcare providers can also take the opportunity at every level of the healthcare system to promote health, prevent disease, and adapt a multi-sectoral approach addressing the wider determinants of health. This primary healthcare approach, integrated well with public health functions, is the most cost-effective and efficient way to strengthen health systems for UHC, health security, and building resilience. Ethiopia's health system adopted a primary healthcare approach since 1976. The Health Service Extension Program is an innovative community-based program that was first introduced in Ethiopia in 2003. And this program was launched after realizing that the basic health services were not reaching the majority of the population. The strategy has been to expand fair and equitable access to health services to all communities throughout the country, with a special emphasis on public health functions. The resulting community-based services all have a strong focus on health promotion and preventative health activities, such as the prevention and control of common diseases, as well as increased community health involvement through engagement and risk communication. The principle behind this approach is to transfer ownership and the responsibility of maintaining health to the communities. The program required sustained political commitment from the government and continued investment that has led to the construction of over 14,000 health posts and the training of 30,000 female community health workers, 2 for each of the health posts, and their deployment in each village. This has led to associated improvements in health outcomes. We've now come to the end of this video, but before ending, let's do a brief recap. This video defined important concepts such as health system strengthening, universal health coverage, and health security, and discussed health system strengthening in the context of UHC and the SDGs. The key message being that health system strengthening is essential to achieve UHC, health security, and the SDGs, including the non-health specific SDGs. And health system strengthening can yield significant benefits for the health and well-being of communities. The video then went on to explain the importance of primary health care and public health functions in promoting the role of communities and building resilience. The 3 main components of PHC were described, which are public health functions, multi-sectoral action, and empowering people and communities. I provided examples of how PHC can build health systems resilience before highlighting the example of Ethiopia's health system and primary healthcare strategy, which has yielded good health outcomes for communities. Thank you for listening and all the best.